If you are watching this video right now, if you are listening to my voice, you are a traveler. In this video, I'm going to discuss with the travelers, should you take the vaccine? Follow along.
Hey, watching on right now, you're watching dcbornrob on YouTube. Make sure to hit like and subscribe.
Okay, good morning, good evening, good afternoon, wherever it is you're located, and thanks for watching. This video is going to be controversial. It's always controversial anytime I bring up masks or the fact that I got vaxxed. 2 shots in, baby. 2 shots in. That's right. 2 shots in 3 weeks, even better, because you can't do anything after the first 2 shots. You got to wait 2 more weeks. But anyway, so this is going to be controversial. I normally get hate comments, whatever you want to call it, trolls that pop out of the woodwork anytime I mention anything that has to do with this. So, you know, bring it on. Everybody's got an opinion. Everything I state in this video is an opinion. It is my opinion. That's why I'm putting it out. It's solely my opinion. There's nothing to say that what I'm saying is correct. These are just my personal beliefs, and I'm going to put them out there. Now, people are going to comment. That's cool. When it gets too crazy, then I'm going to have to remove some of the comments. And when it gets just over the top, like it does happen, over the top, with these long soliloquies where people write out, you know, what's the word, scandemic or whatever they bring up. It's just government taking over our minds and mind control and the cabal and all different type of things. When it gets to that level, then I'm going to have to remove you from the channel. So I'm just going to put this out up front. I'm going to read a couple of stories, but basically I want to talk to you tonight about should you or should you not take it? I mean, it's up to you. It doesn't matter what I'm going to say or what any other YouTuber or anybody else on TV says. You're going to do what you want to do. Basically, it comes down to the reason that a lot of people are not taking it, I think, has to do with lack of trust in the government. I mean, simple as that. I haven't had a flu shot in probably 8-10 years because everybody I knew that got the flu shot got the flu. But in this case, for the past year, I have been running scared. If you've watched my videos for any period of time, you know I have diabetes. So I have a pre-existing condition. That's how I was able to get the vaccines earlier than most. Let's say I think only 13% of the population has already got it done, and I'm in that 13%. And that's the reason that I got it done. And, you know, after watching people who were suffering and dying, I did not want that to happen to me. And my mom is actually taking it too. She's thinking the same thing. Let's get this over with. Okay, you can't trust everything the government says. Yes, that's why I listen to the healthcare providers and the people who are doing all the tests and so on. I mean, you have your sources too, the scandemic people, scamdemic, whatever you call it. You guys have your sources too. So rest assured, before you comment, I know you're watching some sources or you watch some documentary or you heard it from somewhere. You didn't just conjure it up in your mind. It's the lack of trust in the government. I get that, especially being black. I don't trust the government as far as I can throw it. It's simple as that. Either side, Democrat, Republican. Don't put me in one of those camps. I can't stand either one of them. And I don't trust either one of them. This is different. I've been running scared for the past year. I don't like being afraid. I'm afraid of heights. So what do? I conquer that. I can't just sit back and let it get to me. So I've been in the Reunion Tower in Dallas. I have been in the Seattle Space Needle. In San Antonio, I have been in the Towers of America. In Toronto, I have been in the CN Tower in Canada. And not, when you look at the picture of it, not that clump that shows, you know, people go see the sights. I went up in further up in the top of that thing. That may be the highest that I've been. I've also zip lined over a river in the Philippines. I have jumped out of a plane. I have skydived. I have also jumped off the stratosphere in Las Vegas.
Robert, you are recording. Go ahead and take a step forward for me.
I've lost my mind.
Step to your right. Robert, in 3, 2, 1, go.
And I've been in Taipei, Taiwan, Taipei 101 in Taipei, Taiwan. That's hard to say. But I conquer my fears. I don't like being scared. But for the past year, I've had to be scared. Like a little punk, I don't want to sit out. I don't want to eat out. I don't want to go in a restaurant. These people, backing away when the people talking to me. I'm wearing my mask. I'm mad at them for not wearing a mask. I'm mad at the people in my building for not wearing a mask. Guy gets on the day, don't have on a mask. I'm still wearing a mask, and I'm 2 shots in, baby, 2 shots in. But still, I wear a mask. It's about spreading it to other people because maybe I have a 95% chance of not getting it. I took the Moderna, by the way. I have a 95% chance of not getting it, but even those who have gotten it out of that 5% just didn't die and didn't suffer. And that was my concern. I don't like to suffer and I don't like to die. I ain't done neither one of them lately. And I wasn't about to start right now. And I started thinking of all the things I put into my body in my 58 years of life. I mean, when it came to lifting weights and taking supplements, those things are unregulated. I have no idea what's in that. I have no idea what's in a hot dog. You don't either. I don't know what's in a hamburger. You think you know? When it says 100% beef, 100% beef what? You don't know, but you still ingest this. I mean, at some point, you got to go out on faith, right? It doesn't matter what it is. You got to go out on faith. Whether you trust somebody wholeheartedly, you got to weigh the pros and cons. For me, it was easy. I don't want to suffer. I don't want to die. That's why I'm 2 shots in. I asked myself late last year, should I take this vaccine?
Yes,
Absolutely.
absolutely.
Yes.
Oh, of course.
Of course.
I think we all agree.
Yes.
Positively.
Yes.
We all
Yes.
are going to say
Yes.
yes.
That's right. And I'm going to come up with this every time. I would assume that some of you think the same way, but I'm going to guess, who knows? It's 50-50. Some of you, just do me a favor. Don't be too brutal on the hate, because I know some of you people get into it just like politics, and I don't do politics, and I don't do divisive subjects. This is a travel channel. This right here, this discussion and this talk is solely to you, travelers, because everybody here who watches my channel is a traveler. This is a travel channel, whether you're going to Medellin or whether you watch my videos on Vietnam or the Philippines or Dubai or Vail, Colorado, or St. Louis, or wherever else I've drove to DC to get pizza, whatever. I'm a traveler. I would assume everybody here is a traveler also. So I want to jump into a couple of stories that just go over. Should you take the vaccine? Why some are not taking the vaccine? Why the distrust? We get why the distrust. Come on. And I know other people have heard Tuskegee, please, over and over and over and over and over again. I get that, man. And it seems like this virus was made for Black and brown people. It's sneaky. It waits in the elevator. Come on in. The mist can stay in the air, man. Then you can't. I'm holding my breath walking by people. For a year, I went through this. A year ago, we were coming back from Guatemala. A year ago, we were coming back from Guatemala. And so it's been exactly 1 year. I'm just now getting a haircut. I've been cutting my hair for a year. The struggle is real, bro. The struggle is real. So I just got a haircut. I got a manicure and a pedicure. Me and my girl went to the movie the other night. We had the little booth, that sits around the two of us, but still, we still were able to go out. She hadn't taken her vaccine yet. She thinks magically she can't get it. But, I have to be concerned because of underlying conditions. Don't want to suffer. Don't want to die. So let's jump into a couple of stories right quick. Okay, I chose this first story because it has benefits. Benefits to me. Remember, I'm 2 shots in. 2 shots in, baby. Remember, 2 shots in. You need to get your 2 shots or get your 1 shot. Just get your shots. Shot. Okay, look. This says Ecuador joins list of countries open to vaccinated travelers. That is right. All of this is updated, I think, like it said the 23rd, like a week ago. It says, we're regularly updating the full list of countries that have started welcoming visitors who have received their COVID-19 vaccine, including Americans. Okay. Belize, beautiful Belize. And I went over this the other day on places that are open in the country. It says, in order to be permitted to travel to the Central American country of Belize, travelers must present a COVID-19 vaccine card that shows proof of complete vaccination at least 2 weeks prior to arrival. There you go. Remember, 2 shots, 2 weeks, or 1 shot, 2 weeks. Or is it 1 shot, 1 week? I don't know. I did 2 shots. So also Estonia. I'm going to go to Estonia, effective February 2nd. This Northern European country of Estonia has declared that those who have been vaccinated against COVID-19 can enter the country without having to submit to an otherwise mandatory 10-day quarantine. This is bypassing the quarantine. This is bypassing the PCR test and waiting and shuffling and shucking and jiving. Anyway, Georgia, you want to go to Georgia? Not the state, but the country. As of February 1st, 2021, any fully vaccinated traveler from any country is allowed to enter Georgia as long as they present documentation confirming their COVID-19 vaccination status. Guatemala. Gracias, Guatemala. I love Guatemala. If you think I love Medellin, I love Guatemala. I love Antigua. Antigua. This is Antigua in this picture right here. Okay, effective February 24th, anyone entering Guatemala must present either a COVID-19 vaccine certificate with vaccination completed at least 2 weeks prior to arrival. Bam. Iceland. Iceland, I spent one night in Iceland, didn't enjoy it. That's a whole nother video. Effective March 18th, any travelers, including those from the United States who have been fully vaccinated against COVID-19 can enter Iceland. There you go. Poland. Want to go to Poland? The only travelers currently allowed to enter Poland are Polish citizens and residences with their family members, diplomats and other family essential workers, students, and EU citizens and residents. That doesn't change for the vaccinated. Okay, well, what does that mean? You got to be Polish citizen and vaccinated to get back. The Seychelles, it announced that it'll be taking visitors on January 14th. They announced this. International arrivals must have proof of having received a COVID vaccine and must have been administered the second dose if 2 doses are required at least 2 weeks prior. Again, 2 shots, 2 weeks. Slovenia. Want to go to? Oh, that looks beautiful. Want to go to Slovenia? This Central European country of Slovenia currently has a long list of European countries on its so-called red list. Or the countries, the red list countries currently does not include the United States. Okay. You must quarantine for 10 days unless you can provide evidence of a negative COVID-19 PCR test, blah, 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 or antigen test. And another way to bypass the quarantine is providing proof of COVID-19 vaccination. And coming soon are going to be Cyprus, Greece, and Hawaii. Okay, this next story I'm jumping to because it's entitled, well, this section is entitled, What Protection Do COVID-19 Vaccines Provide? You want to know what it covers. So before getting into the logistics of travel in a post-vaccine world, we should first tackle the public health basics of what it actually means to get vaccinated. The vaccines are very effective at preventing severe disease, explains Nelson. So here's the thing. You don't get the virus. You have a 95% chance of not getting the virus in the first place. And out of everyone, and I'm going to show you the statistics by Anish Jha, everyone who has done the test and through all of this, no one's gotten severely ill and no one had to go to the hospital and no one has died. And again, those were my 2 things. Didn't want to suffer, didn't want to die. Didn't want to go to hospital because you got to be suffering to go to hospital, I figured. But just because you get vaccinated does not necessarily mean that you can't get infected with SARS-CoV-2, COVID-19. But it does mean that if you are much less likely to be hospitalized. Okay, there you go. Okay, and he's got this study. I hope I can zoom into this, but it just shows the vaccine trial for Moderna, Pfizer, Novavax, AstraZeneca, and J&J, and that for hospitalized, 0. Who died from COVID, 0. Who died from the vaccine, 0. So, I mean, it was easy for me. I mean, again, all the stuff I put into my body, all the alcohol, all the everything else, man, this was an easy one for me. I'm walking the streets like it was a year ago right now. Well, kind of, sort of. Is it safe to travel once you've been vaccinated? Infectious disease experts agree that being vaccinated gives travels a very important, effective added layer of protection. But with that layer of protection, travelers should take precautions and baby steps, of course. Wear your mask, social distancing. They haven't proven whether or not you could actually carry it because you may get the infection, not the disease. The disease is the sickness, is the same thing with the flu shot. It's not that you didn't get the flu, but you didn't suffer from it. Okay, let's jump to this next one. This one says, experts break down why some Americans won't get the COVID-19 vaccine. Again, ultimately, I think it comes down to we don't trust the government. Simple as that. But so good thing the government's didn't create the vaccine. So it says there are a lot of things that get in the way of people taking vaccines in general, particularly as adults. One is a lot of adults just don't go to the doctor unless we really, really get sick. That's sad. That's America, though. As Associated Press polls showed, Americans have mixed feelings about the COVID-19 vaccine. They say that 50% of the vaccine rate is not good enough to achieve herd immunity. So in this case, we certainly would take the COVID vaccine to make sure that we personally don't get sick. But we are also taking it like we do other vaccines in order to address the population, address it at a population level. The more people that get vaccinated, the less there is a chance of other variants coming out. The longer we wait to get the vaccines done, the longer the possibility of other variants to pop up. So I say it's easy. Let's get this done, because if we don't, it's going to be hanging around. Man, I mean, who wants to live like this? I know you anti-vaxxers are like, don't want to do it, but I mean, the rest of the population or whoever does not want to survive like this. I mean, I say, again, this is all my opinions. You know, get the shots, get it taken care of.
Simone said.
The same poll from the AP shows that Black and Hispanic Americans are 20 to 30% less likely to say they'll be getting a vaccine. The poll found that 40% of Black Americans said there was no way they would be getting the vaccine. Fogarty said, you can trace the distrust to the 1932 back to 1932 when hundreds of Black men became research experiments and were unknowingly injected with syphilis. This is the Tuskegee issue. Now, we all are aware of this, but don't let this stop you. I mean, again, I think this virus is made specifically for us, man. It's sneaky. It's sitting in the cracks. It's waiting. It's waiting on Black, Hispanic, anybody else with issues. They feed us garbage, or we choose to eat garbage our entire lives, and then our health deteriorates and our immune system goes down, and then we're more likely to get it. It's frustrating, man, to see people get on the elevator without a mask and like, it's not going to happen to me. Take the vaccine. Personal advice. I am not a doctor. Okay. This story is entitled, We're Not Looking at the Most Important Vaccine Statistic, and this is efficacy. Remember the word efficacy. Everyone wants to know how well the vaccines work, but a key metric is hardly ever discussed. Okay, the Food and Drug Administration is working through thousands of pages of documentation for an emergency authorization for Johnson & Johnson, which could come through this month. Most states that gradually expanding vaccine eligibility, production of the Pfizer and Moderna vaccines is increasing, and the new studies show good results for additional vaccine candidates as well. The news of the COVID-19 vaccine front of late has been quite good, perhaps so good that our perspective on the fight against the pandemic may be getting a little warped. Case in point, the media coverage of the public reception of the J&J vaccine, you know, it has a lower efficacy rate and people are less liable to want to use it. They want to pick and choose. I mean, I'm like that too. If I see, 2 loaves of bread on the shelf, I go to the loaf that's in the back, or I pick that package of ham that's in the back, or package of bacon or eggs or whatever. I look at the dates and take the one that they just put on the shelf, not that's been there for a few days. So when you see the efficacy rate of only 66% for Johnson & Johnson, that's what people are wanting to do, of course. Okay, so it says, case in point, the media coverage of public reception of the Johnson & Johnson vaccine, which results from its trials, were released last week. According to the company, it should be able to deliver 100 million doses in the first half of this year. But this good news hasn't been greeted with the enthusiasm that accompanied announcements by Pfizer and Moderna. Perhaps that's because of the clinical trial. The J&J vaccine had an efficacy number that percentage of cases prevented entirely. That's what efficacy means. The percentage of cases that are prevented entirely. So it's saying that 66% is for the Johnson & Johnson. So 66% of the people who take this vaccine will not get the disease. But that's what the misconception is. Okay, you don't get the disease, or you could possibly get the disease. 34% is a possibility that you may get the disease. But the fact that you won't suffer and die or go to the hospital should be key factors also. So take the J&J as well. I mean, personally, I just told you I pick over ham. So yeah, if I had the choice between J&J, Moderna, and Pfizer, I'm going to take Moderna or Pfizer. Okay, just because it has a higher efficacy rate. Pfizer has a 95% efficacy rate, and Moderna has a 94.1% efficacy rate, meaning 95% of the times, those who take the vaccine will not get the virus at all. But again, out of that 66%, they still have the same 0 hospitals, have the same 0 people getting ill, the same 0 people suffering. So you can still take the J&J. If you're offered, hey, take it. I mean, take whatever you can right now. It's saying that 34% of the time you may get the virus, but you just won't get sick from it. You'll be asymptomatic or have slight or little, being uncomfortable. So keep that in mind. Efficacy rate. The efficacy rate is higher for Moderna and Pfizer, but the Johnson & Johnson or anything else still covers you from getting sick, suffering, or dying. Okay. This one is entitled, Does the COVID-19 vaccine work against the new coronavirus variant? Okay, it appears that Pfizer and Moderna vaccines are still effective. The variant has been found in 33 countries, including the US. The variant has been discovered in 4 states in the United States. A more contagious variant of the coronavirus has begun spreading around the globe, infecting people in 33 countries and at least 4 United States as of January 5th. Its increased transmissibility is sparking concerns that the COVID-19 vaccines may be sufficient in combating the new strain of the virus. Experts, though, believe these concerns are unfounded. Dr. Anthony Fauci, the nation's top disease expert, said data indicates that the current vaccine should be effective against the new variant called B.1.1.7. The variant first cropped up in the United States on December 28th in a man who had no recent travel history. This indicates that he caught the variant through the community transmission, making it difficult to determine how widespread the new strain has become. It has become detected in Colorado, California, Florida, and New York City so far. So, whereas you can still, if you could possibly get it, they're saying that the current vaccines would take care of that. The problem is if we don't get it taken care of soon enough, if we don't all go out, or not even all, 70, 80% of us, if we don't get it done, then more variants are going to pop up. More, and this is ongoing. It's never going to go away. Do you want to live like this? I mean, get your 2 shots. Okay, this story is from NBC News. Vaccine passports, will they be available in the U.S. in this time for summer? So this is where my anti-vaxxers are going to go crazy. They don't want an extra passport. They don't want any paper. They don't want to be forced to take this vaccine. I get all of that. So please don't throw all that hate at me, because I get that. I don't trust the government as far as I can throw them either. I don't trust either side. Again, I've said this. I don't care. Either side, Democrat, good thing they're not in charge of this. I'm not listening to them. I'm listening to the experts. And again, I remember all the stuff I put in my body over the years. So, and if any one of you guys have been in the military, you've been shot with things you don't even know what it is. I mean, you go through boot camp, you get shot up. You have no idea what they gave us. So, okay, this one says, after getting both doses of the COVID-19 vaccine, I stored my appointment card in a safe. As a lead instructor for NATO Special Forces training, I'll need to prove my vaccination status before traveling to NATO headquarters in Belgium when a person is learning resumes, most likely this summer. But my vaccine card issued by the Centers for Disease Control and Prevention will actually not be enough to prove that I am fully vaccinated, especially for the international travel. The cards are too easy to forge. I'm telling you, these passports are coming. I've been telling you since last fall. I wish I could pull up some video of me. I've told you, it's coming. It's logical. It's going to happen. I mean, this shows that with more than 335 million doses of COVID-19 vaccine administered around the world so far, according to the WHO, the race is on to develop a COVID-19 vaccine passport. Okay, this guy just says, while planning for his NATO trip, he soon learned that it wasn't readily available in the U.S. and may not be soon. So this is what the card looks like. I've got that card under protective care next to my pistol. Vaccine passports that could determine what people can and cannot do, loaded with ethical considerations. Of course, vaccines are still not easily available around the world, and people would be divided into haves and have-nots. Now, I get this, but we're talking about the travelers, right? What percentage of the population are travelers? You are watching this channel, and especially if you made it this far in the video, you are a traveler, okay? So you want to travel. You're going to take this, and you're going to take this. And remember, Ed, I remember you saying, okay, yeah, I'm not taking it unless I have to take it to travel. And I think a lot of people are going to fall in that spectrum right there. You're going to need to take it to travel. You're going to take it. But why wait until then? Get it done. Okay, this story says vaccine passport, how to apply the different types of countries you can travel to. To get the world in motion again, this person, the Secretary General, I'm not even going to try to pronounce their names, of the United Nations World Tourism Organization, has called for a global adaptation of vaccination passports as a wider measure for safe resumption of international travel. Okay, here's the current status. In 2021, the COVID-19 vaccine passport will become the most important travel document. While countries are reopening borders, the clamor for a global acceptance digital vaccine passport is getting louder and louder. Soon, vaccine passports will de facto be a requirement by individual countries to prove immunity. To get the world in motion again, this person, the Secretary General, says it has called for the global adaptation of vaccination passports as part of a wider measure for safe resumption of international travelers. The recent UN WTO meeting called for international health of travel bodies to step up the coordination of its standardized digital certification system as well as harmonized testing protocols. So it's coming. And they just tout the fact that we used to have this yellow card, this yellow fever card years ago. You had to have carried this around with you. And this started 88 years ago. There's some countries you can't go to without getting vaccines, and you need to show proof of it. So what's the difference? I mean, I think if you're going to Africa or some countries, and even South America, you have to have a yellow fever card or some other card. If you're going to the Middle East, I mean, think about this. It's already here. You already need it to travel. So with that said, here's a story nobody wants to hear. I can't believe this is happening. Travelers recount tales of getting stuck in Mexico after positive COVID-19 test. It's happening. It's happening to people in Colombia. I just have not read a story yet. By the way, everything in Colombia doesn't show up in the newspaper. Everything that happens, you don't get to know about it. Okay. Everything does not make. I sift and sort through stories almost daily. First thing in the morning, 6 o'clock in the morning, I'm looking through stories to see what's happening overnight. Okay. This one states, Corey Mudd wasn't fazed by the cleaning crew outside his Mexico hotel room when he and his wife returned from the pool. There was someone wiping down the door and the handles and stuff. He said, hey, they asked me if this was my room, and I said yes. The 30-year-old control room operator didn't grow concerned until a hotel manager and the officials pulled up in a golf cart. They delivered bad news. Mudd's COVID-19 test taken that morning at the hotel so he could board his flight home to Michigan under new Centers for Disease and Control Prevention rules for international flights to the United States was positive. How soon could he pack up and move to another room for mandatory isolation? So your plans right there. What do? Hope you have insurance. Hope you have the extra money for that extra 2 weeks of stay, because not every country is going to spoon that out for you because you happen to get the virus. An hour later, Mudd was whisked to a new, and this is all why I'm saying, get the vaccine. Again, the efficacy rate, 95% chance for Moderna and Pfizer that you won't get it. So if you're a traveler, and I'm talking to you, if you're a traveler, again, if you made it this far into this video, you're a traveler. Okay. An hour later, Mudd was whisked to his new room. His wife, who had tested negative, was given the choice of staying in their casita at El Dorado Casitas Royale or moving into a new room next door to this quarantine wing. She picked the latter. It was the 5th day of their week-long honeymoon on the Riviera Maya outside Cancun. Travel to Mexico and other international destinations open to Americans during the coronavirus pandemic took on an additional risk when the new CDC guidelines went into effect January 26th, and that's requiring for you to have a COVID test to come back. Okay, where's one last story I want to show you. Okay, how many vacationers are testing positive for COVID-19 and getting stuck? Mexico, and this is just regarding Mexico. So think of how many other countries you're going to. It's happening in Colombia. It's happening in Dominican. I mean, I see pictures of people and video of people not wearing masks, and the numbers are going up in Medellin. It's a fact. I mean, they're not adhering to the policy. So, and it's the younger cats who know that they won't die from it. So then the older people or the people who have slight, immune deficiencies are going to have the issue. So this just says Mexico tourism and hotel officials say that the rate of positive tests among travelers since the new testing requirement went into effect is minimal. The Grand and Moon Palace, a luxury all-inclusive resort in Cancun, has had no more than 10 cases. Are you the 10? No more. 10 is enough if you wanted a 10. According to Cesar Falardi, director of operations, together with his sister palace resorts, the rate is 0.4, he said. Okay, so that's 10, but that's only at that one facility or that chain of facilities of hotels. It's nothing, honestly, nothing, he says. Okay, unless you're one of them people. In Los Cabos, another popular beach destination in Mexico, Pueblo Bonito's 5 resorts have had 23 positives, result out of 8,196 tests, according to marketing director Mary Van de Webel. Okay, but what does it matter? So these people are coming up positive, and this is in a resort. And in Cancun and all those, they want to keep you on the resort. They don't want you to leave because you're going to spend money elsewhere. And most of the resorts are all inclusive, so why would you leave anyway? But if it's in the facility, it's like being in a ship. Get the vaccine. Personal advice. Hey, if you're getting any benefit out of my videos, do me a favor, go down and hit the subscribe button, click the bell to be alerted of any new videos, and like helps the YouTube algorithm. Again, the more you hit like, the more YouTube says, hey, these cats like this. They can go ahead and show them some more. Okay? Appreciate it, guys. Thanks for watching, and be safe.
We have a YouTube channel. Like it. Please comment and share if you like the video. Please subscribe and kick the bell.